I had the privilege of interviewing Ms. Shana Gonzalez, who is the Director of Behavioral Health at St. John's Well Child and Family Center. She explained to me that the center strives to work alongside primary care providers in order to provide integrated behavioral health, and their mission is to treat patients holistically to address both their physical and emotional needs. Their treatment includes therapy, psychiatry, psychology for children, adults, and those struggling with autism, those who need support for substance abuse, transgender health, AIDS and HIV patients. They have a prison reentry program, a homeless program, as well as a foster care program in which they give treatment to kids navigating the foster care system. During our conversation, Ms. Gonzalez highlighted some of the trends and imminent problems facing LA's underprivileged communities in the light of COVID-19. She weighed in on children and adolescents' mental and behavioral health. Seen in the pandemic is a stark increase in the number of children and teens who receive mental health treatment. There is a problem of a lack of sufficient mental health professionals and resources in schools, and a lack of parent education in helping their children to manage their mental illness. We have observed a high instance of trauma and some PTSD symptoms in children from families who have been dealing with COVID and COVID-related deaths, as well as the aftermath of a lack of social engagement with their normal social networks. In underserved communities, there's a clear difficulty of access, including a lack of funds necessary for Wi-Fi or internet to access telehealth, including the technology to access their appointments. For some others, it might even be difficult to find reliable transportation in order to access healthcare or to access meals, such as accessing grocery stores. St. John's Community Health Center provides Zoom telehealth appointments to help overcome some of these hurdles. For those patients who do not have access to the internet or computers, they offer telephone appointments so that they can also participate in their mental health treatment. In one study, it was revealed that 3 million children in LA County came to depend on school meals for their breakfast and lunch. However, the closure of schools has had a major impact on food security, and it has led to many families struggling to find the funds and resources to cover basic daily needs such as meals.
It's just different now. I think that kids and adolescents are facing, everyone's kind of facing a difficult time with the pandemic, but I think especially at that age, they're really facing a difficult time where they're not able to go back to school, really disconnected from friends, from sports, from, all kinds of, I think kids really need in terms of structure. And so I don't know if we've necessarily seen an increase in patient numbers per se, but I think we've seen more drastic symptoms, if that makes sense. But definitely symptoms of trauma, like experiencing trauma, I think in general is something that we're seeing. And so the way that health professionals are starting to look at trauma is like there's sort of big T level traumas that cause PTSD, and then there's a bunch of other traumas that we face in our life that can produce similar symptoms to PTSD, but it's not a full-blown PTSD diagnosis. But this is, absolutely what's going on with COVID and, the civil unrest and everything that's happening right now is definitely causing sort of a traumatic response for everyone pretty much. But definitely kids and adolescents are definitely affected, and sort of that, hypervigilance and fear of the unknown and difficulty sleeping and nightmares. So definitely trauma response symptoms.
If we can't form deep social connections because, say, we're social distancing due to a global pandemic, our bodies go into survival mode. We start producing more cortisol, a stress hormone that keeps us alert to threats. Our bodies experience more overall inflammation, a way to prepare to heal any injuries we might get while out on our own without help. And our sleep becomes shallower, so we can wake up to dangers in the night. These survival responses help us get through short, threatening bursts of isolation. But the longer we're lonely, the more these changes wear on our cells and organs. That's why perpetually lonely people are at higher risk for mental, physical, and emotional problems and have weakened immune systems.
As we saw from the video, social distancing mandates lead to isolation and a myriad of social and mental health problems. Previous studies have identified an association between loneliness and depression, suicidality, personality disorders, as well as psychosis. Among people with severe mental illness, social isolation has been linked to higher levels of delusions, a lack of insight or being in touch with reality, and also a high frequency of hospitalizations. These problems go hand in hand with a heavy reliance on social media during the pandemic. Social media and news consumption incite an acute increase in mental health afflictions among families and young people. Misinformation and the infodemic or information pandemic have contributed to mass fear and hysterical behaviors. Ultimately, more resources, professionals, and interventions are required to tackle the pandemic of mental health in schools and communities. Social media overuse and overexposure has resulted in a clear increase in depression and anxiety symptoms in adults as well as teenagers. One challenge is the need to filter out false information and clickbait articles, which only serve to confuse the public and crowd out reliable information. Researchers call for an increase in government interventions in order to provide resources to bolster mental health. As we have learned in class, we have seen that social determinants of health have a major impact on health outcomes and also mental health outcomes for patients and families. These social determinants of health include employment and income status, a genetic predisposition or family history of health issues, education levels, food security, housing security, and also proximity to health centers. These social determinants in general can be defined as the conditions in which people are born, work, grow, live, and age. It's been said that besides your physical makeup and genetic code, your zip code, in fact, has a great effect on mental health outcomes. Here we can see in this map of Los Angeles the locations of many of California Primary Care Association's community health centers throughout South Los Angeles. Ms. Gonzalez, the director of behavioral health for St. John's, mentioned to me that her clinics mostly serve South LA, and they have about 14 locations throughout the LA area.
CBS 2's Rachel Kim explains.
If you live in LA County and want to know who and what area is being hit hardest by coronavirus, the Public Health Department has launched an interactive section on their website where you can find out. One of the things revealed by the data is that the highest death rates are in poor areas. Neighborhoods like East Hollywood, Pico Union, and Westlake have 4 times more deaths than compared with the rest of the county. Many neighborhoods in South Los Angeles, including Vermont Square, also had a high number of cases and deaths.
What we're seeing is that the poor are disproportionately impacted.
Jim Manja is the president and CEO of St. John's Well Child and Family Centers, a network of nonprofit healthcare centers that serve South Los Angeles. They're providing free COVID testing to residents at several sites.
We want to be able to diagnose them, triage them, and get them treatment before their symptoms get much, much worse.
LA County health officials say people living in lower income communities are 3 times more likely to die of COVID-19 than those living in wealthier communities. To bring down that death rate, they say more access to testing and early treatment and care are needed.
We're seeing the social determinants. We're seeing issues of chronic disease that have been festering in low-income communities because of that lack of access is making them more vulnerable.
LA County health officials say overcrowded housing conditions can cause the virus to spread quickly.
During this unprecedented time of the global COVID-19 pandemic, something sinister lurks below the surface besides the coronavirus itself. This is the pandemic of mental health issues, which is accompanied by a myriad of social issues which also deserve our attention. For example, one main group which has suffered in this area are foster youth. These children are often removed from their homes and can be put into an even worse situation, where they might have no one to turn to. Ms. Shayna Gonzalez commented that She finds the child welfare system in our country to be one of the most broken among our mental health care systems. To close, I'd like to share some concluding remarks that Ms. Gonzalez mentioned to me. She said, quote, "My life mission and message is to help people realize that behavioral health issues do not discriminate. We all experience grief, loss, depression, and anxiety from time to time. We all need the support. I hope for society that one day everyone will have access to mental health care the same way they might access a doctor." Overall, our healthcare system is broken in this country. I strive to open access and break stigma. It doesn't mean you are weak if you struggle with mental health issues. It simply means that you are human. Thank you.